Hello, guys. So, when we are creating a report of a mental status exam on a person, we should have these categories into consideration. For example, should be the patient's appearance, how do they look. We have to observe their clothes, their postures, their grooming, if they look presentable, etc. Their behavior, their gestures, mannerisms, expressions, if the client makes eye contact, and so on. Also, the attitude of the client should be evaluated. For example, if the client is open enough, if the client's trying to be evasive, easily distracted, or secretive. Also, their level of consciousness should be evaluated. For example, if the client is alert, drowsy, asleep, or confused. Another component to be addressed in mental status exam is the client's speech, their rate, their volume, and their tone. If it's loud, if it's fluent, if the client speaks clear, and so on. Another thing should be the mood. Their inner feelings should be taken into consideration. For example, the counselor can ask questions like, for example, how do you feel today? How do you feel about this? And how do you feel about this problem? And so on. Those could be the questions that the counselor can ask. Also, we should be aware of the thought processes of the person. For example, coherence of thought in response to general questioning during the interview, how the person is answering the questions. Also, we should ask the patient if they have had any suicidal thoughts or any thought of hurting someone else. And lastly, should be judgment, insight, and attention. How attentive is the client when we are doing the interview of everything that is going on? So when it comes to culture, ethnicity, socioeconomic status, and gender, I believe it plays a key role on mental health assessment. The reason why is because these factors influence the way the person thinks, acts, and behaves in society. So, cultural expectations and norms can determine or judge a behavior as normal, abnormal, pathological, and not. So, a culture can defer their perception of personal identity. So, it depends from culture to culture how they view or how they portray personal identity. Moreover, culture influences cognition, feelings, and a self concept in a person. So when it comes to ethnicity, incorrect assumptions about ethnicity based on the language or appearance alone can lead to misdiagnosis or misunderstanding the culturally diverse person. So that's something that counselors should be aware of those things. So when we as counselors are assessing culturally diverse patients, we have to address these factors so that we can formulate an accurate diagnosis and a treatment plan that could be acceptable and good for the patient. So this is my insight for this week's topic. Thank you.